name is Dr. Sarah Salmons, and I am a breast medical oncologist at Dana-Farber Cancer Institute at Harvard Medical School. I am Associate Director of the Metastatic Breast Cancer Program at Dana-Farber, and I have interest in developing new strategies to improve outcomes for patients with advanced or metastatic breast cancer, and also those patients that are facing brain metastasis. And I am thrilled to be here today to share a clinical trial that I designed with Dr. Carrie Anders at Duke University about 5 years ago that is finally up and running. And that clinical trial is called Bridget. And Bridget is actually named after a family friend who faced advanced metastatic HER2-positive breast cancer over 10 years ago. The trial is named after her, and it stands for Secondary Brain Metastasis Prevention after Intracranial Progression in patients on maintenance for trastuzumab, pertuzumab, or T-DM1 with HER2-positive breast cancer with the addition of tucatinib. And the reason why we think this trial is so important is that almost up to a third, or in some studies, a half of patients that face HER2-positive metastatic breast cancer will develop brain metastasis. And that is when the breast cancer spreads to the brain. And in the first line setting, the average amount of time until a patient were to develop a brain metastasis in the pivotal trial that defined our first line treatment called Cleopatra was about 15 months. But we also know that about 14% of patients with HER2-positive breast cancer will present with brain metastasis as well. And I and my colleagues studied what was the status of the patient's breast cancer from the neck down once they developed a brain metastasis, or otherwise, you know, when we're managing the treatment and the care of patients with brain metastasis, it's important that we're able to manage the breast cancer of the whole person. So do they have any active disease in their body? And how is that controlled? And also what's going on with their brain? And so we learned in a study that we published last year, where we took about 126 patients who had their first HER2-positive brain metastasis and underwent radiation. And we looked at what the status of their breast cancer was from the neck down. So we call that extracranially. And what we learned was that more than half of patients that developed a new HER2-positive brain metastasis actually have very well controlled disease from the neck down. So it wasn't a problem that the treatment that they were on wasn't controlling their disease in their lymph nodes or their breast or their lung or their liver. It was just that those therapies weren't effective enough to control the disease in their brain. And you can see on the right that about 44% of patients had disease that was stable or responding to the treatment that they were on when they developed their first brain metastasis. And almost a third had no disease at all from the neck down. And we call that developing isolated brain metastasis, where they had no disease at all in the liver, lung, brain, or bone. And so currently, the treatment for a HER2-positive brain metastasis, in terms of what systemic treatment, what chemotherapy or HER2-targeted therapy we recommend, there are guidelines to help direct us. And these are the ASCO Practice Update Guidelines for HER2-positive breast cancer brain metastasis. And right now, if a patient is on a treatment, say trastuzumab, pertuzumab, or T-DM1, and their disease from the neck down is stable, but they develop a brain metastasis, the recommendation is to just treat the brain metastasis with radiation or a local therapy, and to continue the same treatment that they were on. And since we have new HER2-targeted tyrosine kinase inhibitors like tucatinib that improve survival and improve disease in the brain and the amount of time until it grows again, I thought that some novel strategies to kind of test this paradigm would be worth investigating and could help patients. This is just a study with tucatinib, which is an oral pill that targets HER2 added to trastuzumab and capecitabine from the HER2 CLIMB clinical trial. And it shows us that in patients with brain metastasis, if they took tucatinib along with their trastuzumab and capecitabine, they lived longer, meaning they had prolonged overall survival, but they also had a prolonged amount of time until they developed another brain metastasis in their brain, which is called CNS progression-free survival. So we know that tucatinib is highly effective in the brain, prolongs life in patients with HER2-positive brain metastasis, and prolongs the amount of time until new tumors develop. So we hypothesized that the addition of a brain-penetrable HER2-selective tyrosine kinase inhibitor called tucatinib after radiation in patients with HER2-positive brain metastasis that have stable disease from the neck down could delay the onset until the next intracranial event or the next brain metastasis compared to historical controls, and ultimately with the goal of improving outcomes and survival in these patients. So this is the study schema of Bridget, which is a single-arm phase 2 multi-center trial of tucatinib added to trastuzumab, pertuzumab, or T-DM1 in patients that have isolated intracranial progression and HER2-positive advanced breast cancer. So patients are eligible if they have metastatic HER2-positive breast cancer. They have a new brain metastasis. And it's either their first brain metastasis event or their second brain metastasis event. And they're on either trastuzumab, pertuzumab, or they're on T-DM1. And when they develop that brain metastasis, they have stable disease or no disease from the neck down, which from my study earlier, I showed you is about 65 to 70% of patients. And patients, this is the single arm trial. So everybody gets the intervention. There's no randomization. Patients will go on to get standard of care radiation to the new brain metastasis. And this would just be local radiation given by your radiation oncologist locally or, at your treatment center. And that's not part of the trial, but you would enroll after the trial, after you got radiation. And so you'd have radiation to the new brain lesions. And if you're interested in enrolling in the clinical trial within 8 weeks of completing your radiation, you could enroll in the clinical trial and you would have tucatinib added to your trastuzumab, pertuzumab, or tucatinib added to your T-DM1. And we're doing scans every 9 weeks, including MRI of the brain and staging scans from the neck down. And the primary endpoint of this trial is intracranial progression-free survival, which is the amount of time until a patient develops a new brain metastasis. And we're hoping to prolong that with the addition of tucatinib based on historical controls and historical studies of what that would be with radiation by itself. This clinical trial is open at 10 sites in the United States. It is currently open at my institution, Dana-Farber, at Duke University, at Ohio State, at Washington University, and at Providence. And it will be open at about 5 other locations in the near future. And this is some information. This is the clinicaltrials.gov identifier if you're interested in learning more or you're interested in showing your primary oncologist the trial to see if they might think it's right for you. And this is the contact information if you would be interested in the trial to try to figure out what location might be closest to you. To go for a screening visit to see if it might be something you could enroll in. One nice thing about the trial is that we've tried to make it as friendly as possible to people that may not live near one of these centers. And you are allowed to continue the trastuzumab, pertuzumab, or the T-DM1 at your home institution, but you do have to come at least monthly to get the tucatinib and get checks and scans while you're on trial. Thank you so much for listening. And have a wonderful day.